Hello. Episode 4 is finally here. We want to welcome you to Hello Day, the podcast that is making a difference. And we absolutely thank you so much for sticking with us from the very beginning. Shiko Kaitani here as your host. As always, we want to hear from you on our social media platforms. Be sure to catch us obviously on YouTube. We are actually getting onto Spotify pretty soon. But some of these conversations have already been uploaded, and thanks a lot for the feedback that we have been receiving. We are so excited as our podcast, as Hello Day, to be teaming up with the Chronic Disease Society of Africa, who have powered this particular conversation. We'll be telling you a little bit more about them as this particular episode rolls on. But we also want to thank our location partner, which is Jenga Leo. They are an amazing co-working space right at the heart of Westlands. Be sure to look them up on their social media platforms so that you can get to understand a little bit more about the amenities that they're offering. So, as part of our themes on this particular podcast, you do know wellness is a big aspect that we like to actually focus on. And when we threw out, the questions out there, did a bit of a survey, asking you to give us feedback on what you think we should tackle on the podcast, male sexual health actually did pop up. We've got just the right person on this particular set to handle this conversation. In fact, he's quite a vibe, if you ask me. You always think these guys are so serious. When do they laugh? And here he is. We're talking about Dr. Patrick Muigai. He's one of Nairobi's top urologists here with us today. Dr. Welcome to the show.
Thank you very much, Shiko. Thank you for having me. And yeah, we are usually a vibe.
You usually a vibe?
Guys usually think doctors are those aloof, laid down people.
Right, so serious and boring.
Once we are done with you as a patient, we have a life.
Oh, really?
Yes.
I mean, I bet your theater doesn't look this nice.
Oh, have you been to one?
No, I don't want to be in one.
Some of them are very pretty, by the way. The only problem is that you won't notice because you are probably asleep or thinking too much.
So what do you listen to, by the way, when you're starting surgery? What's your go-to vibe before you begin?
I always have music in theater.
So what do you listen to in theater?
I listen to anything and everything. So most of the time I have mixtapes, Grouchy, for example.
What?
John Falme. I'll just be listening to anything.
You're cutting me up while listening to John Falme.
I listen to
there's something wrong.
Or depending on what I'm doing, I'll probably be streaming something on Spotify, listening to some Saudi Soul or something. But I'm always listening. There's always music in my theater.
Wow.
And when I'm there and there's music, I'm in my element.
I think Mfalme should feel really good about this. He's actually my friend. I'll send this to him. So you're there busy doing your work on a patient, and it's just like DJ Mfalme.
He should probably come to theater one day and do his things.
Your girlfriend's favorite DJ.
Yes.
All right, Dr. Patrick, you seem to be very, very excited about tackling conversations around male sexual health. Yes. And I think one of the things that make conversations around men very interesting is that how many men are very proactive and willing to also talk about their health complications?
They are not. Most men don't come to the hospitals.
Right.
That is number one. Mm-hmm. But if something touches on a man's sexual health,
Hapo,
everything stops.
Right.
They come to the hospital.
Right.
And it is a common thing we are seeing a lot.
Yeah.
I think also because of awareness, like what you guys are doing a good job. It is creating more and more awareness, and guys are coming to the hospitals. We are seeing more young men, older men, everyone. Men are coming to the hospital nowadays. Initially, we used to find when a man comes to the hospital, he is dying. Yeah. So he'll either be pulled by the daughters or the wives.
Correct.
But nowadays, we see young men are coming to the hospital, and older men are coming to the hospitals, which is a good thing.
Well, I always used to see this a lot on my show on K24, where, would typically be handling conversations around men's health and wellness. And oh my God, the response that's there, behind the scenes, overwhelming. But on the actual show, nobody will call in and say, hi, my name is Simon. Hi, my name is Patrick. I have this question for Daktari. So what is it, doctor, according to you, that makes men really shy off about addressing their health concerns head on?
Because number one, men have an ego.
Okay.
That's number one. So taking themselves to the hospital is a sign of vulnerability. They do not want that.
Yeah.
You're telling a man to go queue with mothers and children. They feel like, no, that's not for me.
Yeah.
So unless they are dying,
Right.
they ain't doing that.
And you would rather even die like a man.
They will not do that.
Oh my God.
Yes.
It's so ridiculous.
That is the biggest problem with men.
Right.
Yes.
Yeah.
They don't like anywhere that they are vulnerable. Yes. You tell a man, oh, you lie here, I need to examine. No. You ain't touching me.
Yeah, I mean, we're so cool. If we are getting our breasts examined, it's a
Yes.
breast checkup.
Yes.
If we are going to the gyna and, we know what's going to happen and they need to take a swab, we're very okay with that. You guys have to brand it differently at the executive checkup. What is an executive checkup?
They want privacy, they want one-on-one, they want where they can open up. And even then, when they come and they meet probably an elderly man has come, he's met a fellow man, they will still be, but you are the age of my son.
Yeah.
I really should not be telling you this. But nowadays they're opening up. They're
Right.
really opening up.
Okay,
Yes,
okay.
yes.
Well, anyway, that's why this podcast is there so they can watch in secret.
Yes.
And then they'll call you on the side.
They can watch when they have put earphones so
Right.
that nobody knows what they are listening to.
Yeah, but that's what these guys are doing here. Okay, so you're a urologist, and
Yes.
I think it's one of those specializations that aren't as common as knowing a GP or a gyna, for example, or a heart surgeon. So when we talk about urology, like, what is your specialization?
So a urologist,
Yeah.
number one, is a doctor. Number two, a urologist is a surgeon.
Okay.
But is a surgeon who only deals with the urinary system. Okay. So, for example, if you need a kidney transplant or you want to donate a kidney, it's a urologist who will come and remove your kidney and put it in someone else.
Right.
Okay. So, a urologist is a surgeon, but he also deals with the other system. Like if you have a kidney stone, you have a kidney tumor, you have a bladder cancer, your urine has blood, your urine is not coming out or it is blocking.
Yeah.
Prostate issues in men, especially male sexual health.
Yeah.
Children with undecided testes. It's big, it's huge, it's a whole system.
Yeah.
And a urologist is not the male version of a gynecologist.
Oh, because that's what's commonly, yeah.
Yes, a urologist treats both men, female, and children. I mean, even female have kidneys.
Right.
Those kidneys can get cancer. They can
Yes,
get
yes.
they can get stones. They can get cancer of the bladder.
Yeah.
They can come with urine incontinence or urine retention that is not coming out, or it
Yeah.
is coming out when they don't want. So we treat a lot of them.
Yeah.
Children can come with undecided testes, or their testes are swollen. So many things.
Yeah.
Yes.
Oh, wow.
And like
Yeah.
you have mentioned, urology is not a field that has grown a lot
Yeah.
in this country. We still have less than 100 for 50 million people. So
Oh, wow.
the numbers, we can still do better.
Right,
Yes.
right. Okay. So male sexual health is also pretty wide.
Yes.
But there's a reason you have a passion for it. And why don't you just break it down when we talk about male sexual health? What do you mean by that?
Now, male sexual health is is a spectrum
Yeah.
of conditions that affect men, and one way or another, a man will be affected by male sexual issues, right? And they are common. They will affect young men.
Yeah.
I'm seeing a lot of young men, and you'll see older men
Yeah.
coming. So this will range from people who cannot be able to attain or sustain an erection. That is called erectile dysfunction.
Yeah.
There are those who they can get an erection, but then they ejaculate very quickly. So that is called premature ejaculation.
Yeah.
There are those who are not even able, they don't even have the desire.
Yeah.
So that is low libido. Then there are those who they can get an erection, but they cannot get ejaculation.
Right.
So that is called an ejaculation. Or even if they spend 30 minutes there, nothing will happen. So that is called delayed ejaculation. There are those who, when they go there, after ejaculating, they get headache
Right.
and they become sick. So that is called post-orgasmic headache.
Right.
And finally, there are guys who, when they go there and after sexual intercourse, they become sick. They get muscle pain, joint pains, even fever. They'll have to go to the hospital.
It's honestly not pleasurable.
It
as
is
much
not,
as they actually say.
It is not pleasurable at
Yeah,
all. So
right.
that is called post-orgasmic illness syndrome. So all these conditions are there. They affect people. Most people, some don't even know. Sometimes I got a call by some guy, actually a friend of mine.
Yeah.
And he told me, hey doc, nowadays I've been getting a lot of headache after ejaculation. I'm actually trying to run away from it.
Right.
Yes, that is a condition. Okay, most people don't know about it.
I know, I'm hearing that for the first
Yes,
time. Yeah.
but they're out there, and men are suffering out there because they, first of all, they don't know that it's a condition.
Yeah.
2, they don't know where to go to. 3, they don't know who to talk to
All right.
about it.
Yeah.
Yes,
Yeah.
and that's why such podcasts like this, they help to bring this awareness out there in the masses. But I'll tell you, the 2 most common
Yeah.
that bring people to the hospital is when they are not able to get an erection, that is called erectile dysfunction.
Okay.
And when they get an erection but they ejaculate very fast, that is called a premature ejaculation.
So
So
those
those
two.
2, I get a lot of people. Every day in my clinic, I will have at least 1 or 2 people who has either of those 2.
Wow.
Every single day, I will see a patient
Right.
who is coming because of one of those sexual
Yeah.
dysfunctions.
Okay, and
Yeah.
so then let's focus on those 2. So when we talk about ED, you know, as in short form, what is ED then?
So when you're talking about erectile dysfunction, basically we are saying, fine, you have the desire, okay, you have the libido, but when you want to rise to the occasion, you're not able to attain
Yeah.
an erection. Or even if you attain it, then you cannot maintain it. You know, ile unapata kidogo kanagonga chini, ndio? Like,
Okay, it's not
Yes.
as funny for them.
yeah.
Yes, it's funny but not funny. I like that.
So you're not able to maintain it.
Right,
Yes.
right.
For sexual satisfaction.
Yeah.
Basically, that is erectile dysfunction. Yes.
And what typically I think bothers quite a number of people is not being able to understand why, you know, they're not able
Yes.
to rise to the occasion.
Yes.
So is it something that you could actually say is lifestyle based? It's really about your choices, or is this something that honestly could be tied to genetics? I don't
It's
know.
a lot of things. It's
Yeah.
a lot of things. So when you're talking about erectile dysfunction, this is a condition that cuts across generation. Okay.
Yeah.
Initially, maybe a while back, it used to be a disease of maybe of the elderly. You know, as you age,
Right.
the erectile function goes down naturally. But nowadays, I'm seeing a lot of young people, 20s, 30s, even 40s are very young people.
Right.
I mean, 30s and 40s, these are guys who are supposed to be at the peak of their sexual
their
career.
prime, yeah.
Yes, at the
Yeah.
prime. But
Yeah.
those are the guys I'm seeing right now. And erectile dysfunction has two aspects. There's something called psychological,
Yeah.
okay, which is common, which is big. And then there's something called organic. So when you're talking about psychological, basically we are saying this is someone who has something that is disturbing them. Okay,
Yeah.
so it's either marital status,
Yeah.
it's family, it is finances, it is work,
Wow.
job. You know, all those things. Okay, cause a lot of psychological. Then there are those guys who have something that you can actually say, this is what is causing your erectile dysfunction. You know, like smokers.
Yeah.
And nowadays everyone is smoking. Nowadays they are either doing shisha, they are vaping, or they are smoking.
Or they're
because-
chewing.
Or they are chewing, because now that is fashionable.
Yes.
Let them continue doing that. I'll still be here waiting for them to charge consultation fee and manage their erectile dysfunction.
That is so
you
mean.
continue vaping and shishaing. We shall be here.
Let them continue.
Let them continue. See,
Yeah.
we'll tell them.
Yeah.
But if they continue,
Right.
yes, they will end up to a urologist.
Right.
So smoking is big. Then there's lifestyle.
Yeah.
So these are guys who don't exercise. They are eating junk. So they end up with obesity and sedentary lifestyle. So that usually what it does is that it causes a lot of cholesterol in the body. So that causes erectile dysfunction.
Right.
The other thing is other lifestyle diseases like diabetes.
Yeah.
Diabetes is a direct cause of erectile dysfunction, especially if the sugar is poorly controlled. There are guys who are on other medication that actually one of the side effects of those medication is erectile dysfunction. For example,
yeah.
the guys who are on treatment for mental health issues, you know, depression, bipolar, schizophrenia,
Yeah.
and some of the treatment, one of the side effect is erectile dysfunction.
Yeah.
Guys who are on treatment for, say, something like prostate enlargement, and some of those treatment causes erectile dysfunction.
Right.
Okay? There are guys who have been on treatment for prostate cancer. There are guys who have spinal diseases. They have some treatment for hypertension.
Chronic Disease Society of Africa is a pioneer institution that supports patient programs and alleviates the disease burden and the suffering of patients who are already diagnosed with chronic illnesses. 5 out of 10 patients are highly likely to be diagnosed with a chronic illness in Africa. However, late diagnosis is a huge burden that makes most of our patients be exposed to care way late in the stages of their patient journey. If you know anyone suffering from a chronic illness ranging from diabetes to arthritis to kidney disease, refer them to our number below.
Their side effect is erectile dysfunction.
Mm-hmm.
So all of these, there are guys who got COVID. And one of the things that we found after COVID is that those guys ended up with erectile dysfunction. Okay. So in a nutshell, and then see what happens is that these guys, when they have erectile dysfunction because of, say, smoking, they get a psychological aspect of it.
Right.
Okay, it starts disturbing them. So now the psychological aspect worsens the erectile dysfunction.
It really does.
Okay? So they end up with something called mixed erectile dysfunction because mixed because they have an organic cause. Say smoking, or sedentary lifestyle, or obesity, but then that thing causes them psychological issues. So they end up with a
double,
yes, they end up with a double tragedy. Yes.
And I think maybe for a lot of people, because they probably didn't even understand what are those stress factors that are causing ED. For sake of even just giving props to other podcasters out there, I absolutely love the Sadia psychologist. She's actually talked about how even with her work, she's coming across even 21-year-olds looking for Viagra. And she was like, this is crazy.
And actually, most of those, we end up sending them to the psychologist, actually. Because it's purely a psychological aspect.
So what is bothering guys? Is it what is it? Because if your mind is not at peace, then the other head is not working. So if this head has a problem,
the other one will certainly not work. It will certainly not work,
right?
Because it's a whole process,
isn't it?
You know, for you to get an erection, it starts from the mind. Like
right.
you have to be stimulated either by sight, by smell, by touch, and then that is interpreted by the brain. Then some chemicals are sent all the way to the penis for it to get an erection. Is actually the last thing in a whole long cycle process. So if the mind is not correct, the other head will certainly not rise up.
Gentlemen, clear your minds.
They need to clear their mind.
And they're busy laughing at people who go for yoga.
I know, right?
Right? This is why you should probably sign up for yoga. So, for a lot of guys who are watching this show, getting to the root cause of your stress or your anxiety is very key.
Yes.
What's triggering
it's good
your
you've mentioned anxiety because the other thing that is happening is something called performance anxiety.
Okay,
especially with
what's
the
the correlation there?
Especially, you see, the young men, what they do is that they will come and vibe a dame, a
they'll
girl.
Vibe Shiko.
Yes, they'll come and vibe Shiko and tell Shiko the things they are gonna do to Shiko. But then because they have put so much pressure on themselves, when they get there, they are so anxious to perform, they cannot do nothing. So it's either they will get erectile dysfunction or as soon as they start, they finish.
Right.
And then Shiko will be there wondering, now, sasa where. Problems.
Bloody.
Yes.
Bloody,
and then now what that does is that now it gets onto your mind.
Right.
And then your self-esteem goes down, your confidence goes down, start getting depression, you don't even want to see Shiko again.
Right.
Yes.
That's so true.
You cannot get an erection.
And you'll find guys who are very put together, look the part, actually very attractive, but have no life. Like, there's no relation with
those are actually
else
the people I see in my clinic.
Right?
Yes.
Right. And it's because they just choose not to be vulnerable enough.
Yes.
To have that experience again.
Yes.
Where does now these kind of vices of, let's say, pornography, coming in and actually being a factor
Good.
to what is stopping men as well. Yeah.
That's a very good question that you brought up, because most of the young people that come to my office are guys who have exposed themselves either to pornography or to masturbation.
Yeah.
Now, what pornography does to you is that, you see, the reason these guys are watching pornography is to get an erection.
Right.
They are so used, the mind is so used to, if I watch pornography, I'm going to get an erection, right? Then it will reach a point where they want to start a family or they want to get into a relationship.
Right.
Okay. And you see, like I've mentioned, for you to get an erection, you need to be stimulated. So for them, the only thing that usually stimulates them is sight. Okay, is watching pornography. That's what
Right.
stimulates them.
Right.
So now Shiko comes into the picture. No matter what you do,
Yeah.
they cannot get an erection because the brain is wired to
Yeah.
sight. So if pornography is not there, they are not going to get an erection. Okay, so that is what pornography does to you. It gives you erectile dysfunction because of the stimulus. Now, the other vice, especially the young people, is masturbation.
Yeah.
Now, what masturbation does is that, you see, most guys who masturbate, their goal is only one. They want to ejaculate.
Yeah.
And because it is a shameful act, they want to get done with it like this
Right.
in a second. Again, the brain becomes wired to masturbation, orgasm.
Yeah.
Period.
Right.
So what that causes is something called premature ejaculation. So unless now you go for counseling
Yeah.
and those vices are get out of the system, you will still continue coming because of premature ejaculation. If
Right.
you're watching pornography, you'll come because of erectile dysfunction.
Yeah.
And these are the guys now we send over to psychologists.
Right. Because now it's a mind issue.
It's a mind issue.
You're
It's-
like,
it's a
I don't need to
psychological
give
issue.
you, yes, I
Yes.
don't need to do anything. I
Yes.
don't need to work on you. Just go
Yes.
go work on, yeah.
So sometimes it will be both psychological and medical.
Yeah.
So you'll come to the urologist, he will treat you and send you to the psychologist, so that we both treat you at the same time, because all of us have the same desired goal. We
Yeah.
want you to be fine.
Right.
Yes.
Because now we are seeing even people who are in pharma, in pharmaceuticals, talking about the kind of booming sales with things like the blue pill,
Yeah.
the Viagra, and all that. What's really your take, Doc, on all that? Because the fact that you still have people checking in to go and get over-the-counter drugs, right? For this, I mean, like, is there an issue that they really need to address?
Yes.
Or
So
what are you doing on this? And by the way, is it even recommended if I just do it maybe like, if I take maybe like once every 3 months, is that fine?
So number one,
the frequency.
number one, it is not recommended.
Okay.
That's number one.
Yeah.
Number two, it is a failure on our regulatory authorities, like
Right.
the Pharmacy and Poisons Board, because they should be able to regulate that you only should come with a prescription. It's a
Right.
prescription drug.
Oh.
But having said that, let me say that erectile dysfunction is not a disease on its own. It is a symptom of something. So it's either a symptom of a psychological aspect.
Right.
It's a symptom of you are smoking. It is a symptom of your cholesterol is high. It's a symptom of you probably have a heart disease.
Right.
And erectile dysfunction is usually the earliest sign that you might actually get a heart disease.
Oh, wow.
Because what happens is, you see, for a penis to become erect, blood must flow into it. The only reason why penis become erect is because blood is flowing into it.
Right.
The moment you ejaculate, blood flows out. Then it becomes flat. It becomes flaccid. All right?
Yeah. Okay.
So
Yeah.
when you get...
I don't know if I should say TMI, but okay. Okay, but go for it. Go for it.
so for it to not become erect, it means blood is not flowing there.
Right.
All right. For one reason or another. One of the reasons is because there's probably something that is blocking that blood, and that could probably be cholesterol. Okay. Now, if it is blocking that smallest vessel inside the penis, it means the next organ is going to block will be either your kidney, your lungs, your brain, or your
Wow.
heart.
Yeah.
Okay.
Yeah.
So you might just fall down because you got a heart attack. And that is because you ignored
Yeah.
erectile dysfunction. Again, erectile dysfunction is a symptom.
It's a symptom.
It can be a symptom of a mental issue.
Right.
So you might ignore the erectile dysfunction, end up with depression, and
Yeah.
commit suicide. See,
This
it
is
is
the
a
thing.
whole thing.
Yeah.
So it should not be, oh, I'm not able to get an erection, let me go and buy that.
Yeah.
No, it should be evaluated. Because if, for example, you are diabetic, the only thing you need to do is control your sugar.
Right.
Why we don't need treatment.
Yeah.
If your cholesterol levels are high, you just need to get treatment for high cholesterol levels. Period. Yes.
And the dangers of consuming the over-the-counter drugs, and the fact that I'm not consulting a specialist on the dosage that I'm taking, on the frequency of these drugs. What would you like to tell those who are secretly doing this?
You see, drugs are poison. Listen, all drugs are poison.
Oh yeah, someone called Faith told me that yesterday. Yeah, the drugs are poison.
Is this the same Faith I know?
Right, it is.
I think we both know her. So drugs are poison.
Yeah.
Okay. If taken in the right dosage, then they become medicine.
Okay.
All right. If
Yeah.
taken in the wrong dosage, they become poisonous. And every drug has a side effect.
Yeah.
Now, drugs usually interact with other drugs. Okay, so if you don't know the dosage, you will most likely come with a side effect. If you are taking it with other drugs that are not supposed to be taken together,
Yeah.
you might drop dead. Okay, so that's why you are not encouraged to go and do over-the-counter medication, because you don't know, is this the drug, is it fit for me?
Yeah.
You might have other issues, you might have cardiac issues, heart diseases.
Yeah.
Then you go take that drug, you have other drugs that you are taking for the same, and you drop dead.
And that's what we typically see. But all we focus on is that, they took the blue pill and it killed you. But we're not understanding the chemical reaction
Exactly.
that's
And
taking place in
let
the
me
body.
just say now that you brought up is that most people who drop dead, the only thing we hear is that he died in a hotel with another lady.
Right?
Okay, and then we assume that he was on blue pills, or the blue pills are found somewhere
Yeah.
in the vicinity.
Yes.
Right? Most of the time, it's usually not the drug that killed them. Okay, they probably had another underlying condition. They were probably going to get a cardiac disease, a heart attack.
Wow.
Or they probably had an aneurysm.
Right.
That's basically a ballooning of a vessel that ruptured. The only thing that happened is because you exerted yourself, in the sexual act, because the blue pill gave you an erection.
Right.
But you probably would have exerted yourself somewhere digging, farming, or climbing stairs.
And still
it
gotten
would,
this-
and still drop dead.
Because this thing is a catalyst. Like, it takes you from 0 to 100.
Exactly. It is a
Okay.
cutter. It's not the one that gives you the heart disease. You probably had an underlying. That's why you need to be assessed first to be told, do you qualify for it or not?
Correct.
Yes.
Right.
Because
right,
it will
right.
catalyze you
Yeah.
to exert yourself in a strenuous activity
Yeah.
that your body cannot handle.
Right. It sounds to me like you didn't want this, but you are a psychologist.
I am not a psychologist.
No, but it sounds like that this has to be a huge part of your discipline.
Yes.
Talking to patients
Yes.
is a huge part of the treatment process for you.
Yes.
So tell us about that. Like, does it turn into, first it has to start with the counseling?
So it depends.
Yeah.
It is going to depend. Like when you started, you remember I mentioned it's organic
Yeah.
and psychological or mixed.
Yeah.
Okay. So we work. See, medicine is usually not our. Most often than not, is not a one-man game. Okay? We always work together. So I have psychologists I usually work with
Yeah.
that I'm going to send patients to, and these are guys who have handled a lot of patients with male sexual dysfunctions. They are going to sort them. All right. So once I make a diagnosis and I feel there's a huge component that is psychological,
Yeah.
I send to them. Okay, because I might talk to you, but it's not my domain.
Yeah.
Okay.
Yeah.
So you need someone to desensitize you, for example, from pornography, from masturbation, from all the issues, either marital status issues,
Yeah.
finances,
Yeah.
job, all those things. You need, like you mentioned, everyone needs a clear
Yeah.
a peace of mind. If you're not going to get that peace of mind, even that erection will not come.
And how do you encourage partners to overcome this together? Do guys tell you, by the way, my relationship is on the rocks 80% of the time?
Yes.
Are women walking out? Women are
A lot.
zero chills.
Let me tell you.
Talk to Judith here.
I have-
Judith.
Judith looks like the good one.
She will
But
stick around. No, by the for real, she actually is. Oh, ne modo wanga imono.
Judith looks like the good one. But I'll tell you, I had a gentleman who came and he told me, Doc, I've lost 2 girlfriends
Oh,
because of premature ejaculation.
Yeah.
But now the third one came and told him, hey, there's actually a disease. Let's go to the hospital.
oh wow.
That's the one that came. Nowadays, I'm finding more couples coming together, especially young guys. I'm finding more couples coming together.
Right.
The elderly one, the 60s and the 50s, anakuja man solo.
Na naambiwa by the way ujipange.
No, wana have a bedroom. Nitakuwa nikilala huko.
Again, listen to the Sadia psychologist as well, because when she tackled this particular conversation, she also talked about how a lot of men who are dealing with premature ejaculation are people who tend to engage in paid sex. Reason being, there's no feedback.
Yes.
And so if you're paying someone to do this for you, they don't have to give you a report on your performance.
Yes.
So it works out.
Not your spouse.
Yeah, I mean,
Yes.
it works out for you to actually, get into, purchasing.
Yes.
So you'll go out, either get a call girl, you'll get someone who's probably off the street. Nowadays it's online, so you can organize for all this stuff. And it's quite sad because they just, someone doesn't want to hear that.
Yes.
And be given a report and be told, oh, by the way, this is actually a problem.
Yes.
We should go see
Yes.
Dr. Patrick.
Most of them are running away from their home because even their partner don't want to, please don't come and disturb me and leave me hanging.
Yeah.
Okay. So they would rather go out there where they will have their 1 minute and they're fine.
Right.
And that chapter, it is transactional.
It's
See, at that point, it is
right.
transactional. But when you come home, then there's a lot of emotions
And expectations.
right. to it. But there's treatment for it. So
There's treatment for it.
There's treatment for it.
Okay. And then very quickly as we start winding up, one of the frequently asked questions is really about fertility issues based on these male sexual health issues. Are you going to say that probably things like ED, premature ejaculation could be tied to fertility issues, Doc?
Now, male infertility, Shiku, is another very, very big topic.
It's another monster on its own.
It's actually, and it has become so common, so prevalent. It's actually another topic of discussion on its own.
Right.
It's very big. Now, but in a nutshell, erectile dysfunction and premature ejaculation will not give you male infertility. Because, I mean, if you're having premature, for you to fertilize, you only need to ejaculate once, whether it is within a second or within a minute or after 10 minutes.
Yeah.
Just ejaculate. Okay. So you see, premature ejaculation will not cause infertility. Erectile dysfunction can if you're not able to get an erection at all.
Right.
But when you're talking about male infertility, we are basically saying either you're not able to produce sperms at all, or you're producing but they cannot come out, the tubes are blocked somewhere, they cannot come out. So there are very, very many reasons for that,
depending even on the quality of the sperm. All that.
So that is a whole big humongous topic that is very emotive again. Yes,
but we'll definitely call you for that one.
I'll be here.
All right, Daktari. As we say Kwaheri, I'll give you the opportunity to let people know how they can reach you. But there is an exciting summit coming up. There's the Chronic Health Summit that I understand you're also going to be participating in. Tell us about the summit, what your expectations are, what it's all about. Also, the role of urologists within this particular summit. Where do you guys fit in this conversation?
See, the Chronic Health Summit, most of guys who have chronic diseases are usually underserved. Okay. And also because, see, most insurances will say there's a chronic disease, we don't touch it, but where should they go? Okay. And that's why the Chronic Health Summit is happening, to address these myriad issues. Now, the urologist, there are many conditions that are chronic. Okay, I mean, even erectile dysfunction can become chronic, especially as you age. You will have to live with it. If you're diabetic, for example, erectile dysfunction is going to become a chronic condition for you. And you see, most insurances will not approve for treatment for erectile dysfunction. Why? Is this not a disease? It is a disease that affects both your mind and your body.
Right.
It should be sorted out.
Yeah.
But one of the commonest chronic diseases that we deal with, especially as urologists, is prostate cancer.
Yeah.
Because most of guys who get prostate cancer come early when the disease is stage 3 and stage 4. Those guys are going to live with that disease.
Right.
Okay. They'll probably die with their disease, and they're going to live with it. Okay, so it's a big thing,
Yeah.
and I'm actually excited about the Chronic Health Summit.
Yeah.
I'll be attending and hear what they have to offer and what the policymakers have to say about
Right.
the Chronic Health Summit. So if
Yeah.
you're a healthcare provider or you are part of the pharma insurances, you're welcome to
Yeah.
the Chronic Health Summit.
Fantastic. Okay, so for whoever has been, inspired or at least challenged by this conversation, and they're thinking, you know what, I really need to consult with Dr. Patrick, how can they reach you?
Yeah, so they can. I used to do a lot of awareness on social media.
Oh,
by
really?
the
You're
way.
one of those docs.
I'm
You're
one
an
of those
Insta. You're an
docs.
Insta
Yeah.
doc.
I'm actually more on TikTok.
Wow.
I do some small snippets about even this erectile dysfunction. We've discussed it
Wow,
on TikTok.
cool.
You can even see me in theater operating. So you go
wow.
to TikTok and watch those videos. On Instagram, I'm Dr. Muigai Mararo. So if you want to reach out to Dr. Muigai Mararo, my office is in Upper Hill, a building called 40 Suit. 40 Suit is a tall building next to Kenyatta National Hospital.
Okay.
On the 8th floor of that building, room number 9, our office is called Mirazi.
Okay.
They can reach us out
Wow.
there.
Fantastic.
And we'll
Okay,
serve
I'll
them.
definitely be looking out for you on TikTok, that's for sure.
No problem, no problem. You will also learn.
I will learn a
You
thing
will
or
also
two.
learn, yes.
And we hope that you actually have picked up a thing or two from this particular episode of Hello Day. Again, we will be bringing you more wellness conversations as we move along. But a big thank you to our urologist on set, Dr. Patrick Muigai, for joining us. We do know that, by the way, this conversation can be quite bulky, quite heavy when you're talking about male sexual health. And we will start a series as we move along with Dr. Muigai, God willing, inshallah, our VP.
41 million Africans die from non-communicable diseases every year. This is because the non-communicable diseases hasn't been given the correct attention that is required. A number of researches that have been sponsored in Africa has largely been on the communicable diseases end. Today, it is established that 86% of those deaths are occasioned from 4 major categories of diseases, namely cardiovascular, cancer, diabetes, and chronic respiratory illnesses. 77% of this group is also determined to be coming from low and middle income level families. There is a call for action and there's a cause to act. This is why the Chronic Diseases Society of Africa is inviting you to the inaugural Chronic Health Summit that's going to take place in Nairobi at the JW Marriott, where we are converging from health workers to patients to discuss the best ways of paying attention to this menace called the chronic illnesses.